intro. Going to stream in 5, 4, 3.
Good evening and welcome to the Warrior Healing Center's live stream. We've got Tim Kirk and Kathy Goodman here. And
Who's
Ferg.
this?
This is Ferg, the super dog.
Ferguson.
This is his debut on live stream, so we'll see how he does.
He's only here because we heard that dog saliva prevents you from catching coronavirus.
Oh, well,
Ferg.
Thank goodness for that. Are you going to share some dog saliva with us?
At least
Doggy spit?
Dog breath. Oof.
Awesome. Well, welcome, Ferg. We'll see how you what you have to contribute. Maybe it's just cuteness to get people to pay attention to us. We'll see.
Yeah. Good boy.
But we are live streaming from the Warrior Healing Center here in Sierra Vista, Arizona. It is 11 March, 5:30 p.m. And we find that it's probably pretty timely for us to have a discussion about coronavirus here, because why not? Everyone else is, right?
Yes.
Nice.
Mm-hmm.
So Tim is our resident expert on everything coronavirus, only because he has consumed everything out there in the last probably 3 months that surfaces with coronavirus tied to it. So he's reading it all and sharing lots of information with us, which has been really helpful. There's a lot of misinformation out there. There are a lot of people who should have a more appropriate message to share with people than they do. So we're hoping to dispel some of the misinformation that's out there and kind of let you know why we feel that coronavirus is important, and we need to start getting serious about how we respond to it, because in this country, I think the normal response at this point is BS. This is not a big deal. It's all media hype. I've been fooled before. I don't want to be fooled again. Everything from Y2K to SARS to people just saying it's just more people die from the flu, so what's the problem? It's just a virus. I mean, I've got healthcare providers that I've worked with that are like, it's just a virus. Why all the hype? Well, we're here to help explain why there needs to be some hype. Not panic, mind you, but some legitimate understanding of what's going on. And so here we are, and I will turn it over to Tim. He can talk a little bit about the beginnings. We apologize. We had a glitch in our previous attempt here without sound, so we're hoping that sound is coming through right now. But you were telling us so well what happened starting in Wuhan, I believe.
Yeah, so, there's a lot of competing theories and probably misinformation out there about where this coronavirus came from. And coronaviruses themselves aren't new. They're called coronaviruses because of those little spiky things that you see on the ball that is the virus, because they look like crowns, and that's where the corona thing comes from. So they're not new, but this particular one is new because it's called a zoonotic virus, one that can infect both animals and people. And they hypothesize that this one jumped from animals to people, although there is some theory that the fancy schmancy biological research lab that they created over there in Wuhan that they were so proud of, that they posted this big kind of braggy Facebook post back in 2018 about. There is some speculation that maybe a bug got out of that facility and that's what started this whole thing. Nobody knows. Obviously, being a communist country, the free flow of information is not highly prized, shall we say, by the local authorities. And as a result, the two guys who really informed the world about the existence of this problem, they were treated very badly when they started publicizing this at first, and have since disappeared off the internet. So there's all sorts of speculation as to what happened to those guys. Who knows? Maybe they were in the foyer waiting for a hotel room when the hotel that was housing the quarantine victims of coronavirus collapsed on itself just a week ago.
Just a little suspicious.
Yeah, slightly. Well, it was a very old hotel. It was built way, way back in
2018?
2018.
God.
I mean, come on. How old were you back in 2018? I can't even remember what I was doing way back in 2018. It was so long ago.
Those standards may have changed.
It's
a little
really,
bit.
really, really a long time ago. So, what has happened since? The Wuhan virus, COVID-19, has become a traveler's disease that has then transmogrified into a community disease. And you see the outbreak going from country to country, spreading from community to community, and now we have some hot spots around the world in places where they're able to track it. And the reason why I say able to track it is because you've got some places like Italy and Iran and South Korea where they're tracking it very well, and other places in between, especially in Europe and in Asia, but other places where, for example, you have India, Bangladesh, and Pakistan, where between the three of them you have nearly 2 billion people all living very close together. And yet those three countries combined are declaring less than 100 cases. I'm just not believing that.
Yeah, especially understanding the populations out there and the living conditions as such, it seems like that's probably highly unlikely. But you also have to take into consideration they may not have the testing
I know they don't have
materials
the testing.
to be able to
Exactly.
determine. So there's a lot that goes into it. But
Exactly.
yeah.
I'm not accusing them of deceiving anyone. I'm just thinking that we probably have a much bigger situation going on than what we realize. Because while we're talking about Italy and their measures, South Korea and their measures, Iran and their woes, you can't even imagine the humanitarian potential in those three countries, Pakistan, India, and Bangladesh, because of the living conditions, the state of the medical care system, and the size of the population. Then you've got other places that are like it, Indonesia, Myanmar, Thailand. You've got some just amazing potential for things to go horribly, horribly badly, and we're just not hearing about them because, as you said, Kathy, they don't have the capacity to diagnose or report on these cases.
Right.
But here in the United States, for example, on 1 March, we had 69 diagnosed cases in the United States.
That were reported.
Mm-hmm. And as of Sunday night, the 8th of March, that number had risen to 531 cases. So a 7-fold increase, which is, a pretty substantial number. Now, it's early in the ballgame, and those numbers are relatively small compared to what the rest of the world is dealing with. So it's not a trend. It's just an initial data point. It's an initial observation. But where we stand right now tonight, hit refresh on that screen. Let's see where we are. We're up to 1,303, and we've grown by 309 just today. So since Sunday, we've grown from 531 to 1,303.
And for those of you that are wondering, you can find this. It's on worldometers.info/coronavirus. That's where we're getting this information, which is updated real time. And so that's kind of what we've been monitoring very closely for the last several weeks.
So that shows you that we've got a very contagious disease. It's not the flu. It is spreading from person to person. And since there's no vaccination for it, there's really nothing standing in the way of this virus spreading other than isolation.
Let's slow down just a little bit, because I think there's some things that we need to understand or to put into perspective, really. So as I was mentioning earlier, it's the response of a lot of the people that we interact with is kind of pushback. Like, I can't believe the hype. I can't believe there's panic. Why are people selling out of toilet paper? all of this craziness that's going on. This isn't what I want to deal with. I've been burned before by the media.
Y2K.
Yeah, like that's people in our society are hesitant to think that this is a real problem and to understand the urgency and the importance of it. But think about it collectively, right? Like you may be, whoever you are, you may have risk or not have risk, right? But say, you're not concerned that this is a big risk to you. It's just a virus. And God forbid, if you get the virus, it may knock you on your butt for a week and you'll be uncomfortable or whatever, but you're pretty healthy otherwise and you're pretty sure you'll recover and it won't be a problem. Yeah, that's fine and true. There's no need for you to panic, but at the same time, let's think about it a little bit differently as collectively for our society. Because if everybody is hit by this at the same time, that means there's going to be people not able to go to school, people not able to go to work. The big concern, and one of the big concerns, is the healthcare system. If we've got hospitals that are full of people with this virus, it's not going to take any time at all for the healthcare providers, the nurses, the doctors, the therapists that work with those patients to also come down with the illness and get sick. The amount of supplies that we have to treat those patients are going to be strained. The amount of beds available in the hospitals are going to be filled and unavailable for use. One of the problems we've already seen is just getting the test kits available and in the right hands. I have a friend who was tested 2 days ago in the Phoenix area because he happened to plan his travel awesomely and happened to be in Italy 2 weeks ago when all of this was going on. And then on the plane ride back, more exposure with students and everybody whose overseas study abroad trips were being canceled and whatnot, comes back and starts dealing with pneumonia. And of course, he's being tested for it. Well, they took his saliva and his blood 2 days ago, and he's not even expecting results for that test until Friday because they need to send those specimens all the way out across country to Baltimore and have the test done there and analyzed and then the results provided back. So it's not efficient yet. We don't have the tests or the ability to run those tests effectively, efficiently handled yet because this is all new stuff, right? So it's not that it's anybody doing anything wrong, it's just a strain on the system. And so just imagine collectively this being as contagious as it is, if we all are getting sick at the same time, it's going to be a big strain on our society collectively. And so that's what we need to think about. It's not you individually, it's much bigger than that. And understanding how these diseases transmit. I had a nurse friend post earlier on Facebook, well, just wash your hands, people. Stop freaking out. It's not a big deal. Use common sense. Well, yeah, but I wash my hands all the time. That's not necessarily going to prevent me from catching it because if somebody sneezes, it's transmitted via air. And we don't even know the full extent of how it's transmitted and what the limitations are. We know there's a lot of nuances to this bug. Or to this virus that are not totally clear yet. One of the things we were reading not too long ago is that women between the ages of 30 and 50 are pretty much asymptomatic. Well, that actually kind of gives a little credence to the fact that maybe this is a bioterror bug created in a lab for a purpose, right? Because if you build it in such a way that your women between ages 30 and 50, who in a lot of places serve as your main nursing force, your school teachers, your just mothers in general, not to mention, there's other categories and demographics as well, but if they don't even realize they're sick, but they're carrying the bug and they're spreading it effectively, efficiently, very efficiently to other folks, that can wipe out your society. So it's important to keep all these things in mind. It's important to pay attention to the numbers and the trends. The fatality rate right now, did we talk about that since the mics are working? Why don't you talk about that?
The important thing to remember is there is so much that we don't know. That all these reports are initial data points that are coming out of really catastrophically crisis situations. So the data coming out of China, South Korea, Italy, France, Iran, these are places that are knocked sideways by this thing. So it's kind of like eyewitness reports at a mishap. There's a lot of eyewitness reports that are just flat wrong, because you can have 10 eyewitnesses who see 10 different versions of the same event. All the data that comes in is immediately suspect because it's coming out of a crisis. These are people that have all been part of a massive 10-car pileup, if you will. And so we just have to wait for more information to come in that can be validated. But the part that we definitely have that is a fairly good representation of reality is the case numbers and fatality numbers. Again, China I find suspicious because of how they've changed the way they're counting things and the impact that it's had on their overall picture. So I just take a look at all countries other than China when looking at the big picture, particularly for their fatality rates. But when you do that, when you isolate for China, all the other countries are following essentially the same pattern, especially when their sample sizes are big enough. And that's where we have to pay attention. And with no politics, with no hype, with just the cold, sober look at the numbers as best as we can tell, that's where we can start to interpret, okay, does this data suggest that this is just another flu, or is this data suggestive of something else entirely? As we said, the contagion factor definitely suggests something other than the normal flu. And you can put it to the test. We went from 531 to over 1,300 from Sunday to Wednesday. If by next Sunday we're over 4,000, then you know we're on the same trajectory that we were on in the previous 7 days. If we're not over 4,000, that means the rate of growth has begun to slow. It's that simple. You can use that data in order to ascertain whether or not the rate of growth is holding steady or whether it's slowing down or, hopefully not, picking up. Same thing with determining the fatality rate that Kathy is describing. A lot of people are trying to make comparisons between the flu or previous outbreaks like SARS and MERS or Spanish flu from last century. And you really can't do that in the midst of an outbreak because they like to take all the number of infected people and then take the number of deaths and divide by the total number of infections. The problem with that is that you don't know how those total number of infected are going to turn out because they're still active cases. They're currently infected. And so you have to take how many people have been infected and resolved. Have they recovered to health or did they die? Add those two numbers together and then divide the number of dead by that. And that gives you an idea of right now today, if someone catches it, how likely are they to survive? And that's also a highly localized number. You can get a global percentage and then you get a localized number because, as Kathy mentioned, the more overwhelmed a medical system is, then the harder it is for that medical system to provide responsive care to those infected, and the chances of survival go down. So you have to take a localized look as well. So far, the numbers don't look good in the United States. We've had 15 people recover to full health.
And it's up to 38 now.
And 38 people have died. Now, it's early in the game, and those are small numbers compared to the other countries, but it is just an indicator that we're off to a rough start. Worldwide, if you take out China, you're talking about roughly an 18% death overall recovered outcome.
So talk about that a little bit, because I think there's a lot of folks out there that are looking at the numbers and thinking, well, this is your total number of people that are infected with it, and this is the total number of deaths. So it's really not such a big deal.
Right.
There's more people that die from the flu. There's more people that die from other things.
Right. And if you look at the WHO's numbers, they do a projection based upon the percentage of people that have recovered, and they do what's calculating for theta, which is it's a parametric extrapolation of what's happened today in order to understand, okay, we can statistically expect it to come out this way. And what they project is a 3.4% fatality rate overall when all is said and done.
What is your deal? Time out for a second. Let's just let him down.
Okay. Where do you want to go first?
Ferg's done with the chair.
So if you, in fact, have a 3.4% fatality rate, that's far above the Spanish flu of 1918 to 1920. That's far above the seasonal flu. Even some projections were putting coronavirus at 1%. I still have not been able to validate the math that puts it there. But let's say, for sake of argument, it is only 1%. That's still 10 times as fatal as the seasonal flu, which is 0.1% fatality rate. So the bottom line here is still early in the ball game, still lots that we don't know. But the early returns show that we have a very, very contagious disease, no inoculations that are effective against it, and no known natural immunity. There are some demographics that seem to get it less than others in terms of the fatal version of it, but at the same time, I wouldn't take any comfort in that, because we were just looking at some CT scans of a 44-year-old male who was one of the first ones to catch it, and his lungs were decimated by the virus, and he eventually died. And he was 44 years old and otherwise good health. So
it's serious.
Pretty much don't believe. I mean, you may survive, but your lungs could be horribly scarred for the rest of your life. I really would be suspect of any kind of generalizations. We don't know how much it mutates. We don't know how much it's going to shift from population to population. We really don't know what we don't know. But for now, highly contagious and a relatively high fatality rate for the kind of viruses that we've seen in the recent past.
So coming back to kind of the collective threat, right? Like, yes, there's different levels of threat perhaps for the individual, but collectively, as a society, we need to take some prudent steps to try and at least slow down the transmission, if not be able to eliminate it. I don't know that we'll be able to eliminate it. I think it's a matter of we need to try and prevent it all from happening at one time, because I think that's what's going to bring us to our knees as a society. That's what's going to ruin infrastructure. That's what's going to ruin healthcare. That's what's going to ruin, it's just going to strain everything if we're all down with it at the same time. So what we did here at the Warrior Healing Center today was made the decision, we talked with our board earlier this week and made the decision that we're going to go ahead and cancel and postpone any events that are not mission critical for helping veterans here. So we're going to continue working with veterans on an individual basis, trying to help keep them afloat and meet their needs and keep things going well for them. But, you know, we've got a lot of nice to have activities that are fun, but that really are going to increase exposure, and we want to avoid that stuff. So we've canceled Bagels and Brew for the rest of the month, and, you know, we'll keep an eye on how things go with coronavirus, and eventually that'll be back on the table with some of our other classes and stuff. But it's not the popular choice necessarily, but we think it's really important, and it needs to happen across the board, though, because anytime you've got a lot of folks in the same room or the same event, the same area. I mean, March Madness, we were just reading, they decided they're going to continue the tournament, or they're going to hold the tournament without any fans, which good for them. I'm sure the financial impact that they will feel for that, not to mention the irritation by a lot of the fans. But really, what are you doing? You're taking a bold step, but it's going to help eliminate some of this, or at least at that event, you're not going to have the exposure that is going to make this a lot more highly transmitted, I guess.
Well, and from a bigger perspective, we need to take responsibility for ourselves and our communities across the country, okay? Our medical providers are going to they're going to absolutely tear themselves apart to stop this thing from hurting us, okay? They're going to go to 24-hour shifts if necessary. They're all going to cancel their vacations. They're going to cancel their spring breaks. They're going to cancel all their personal time and sacrifice everything they've got in their personal lives to care for the members of their communities all across the country. If this thing is the big one that everyone's been afraid of for the longest time, our medical professionals in America are going to do everything within their power to stop it. But we can help them. We can help them by buying time and flattening that curve. Because as Kathy's talking about, if we stop the needless gatherings and stop the human-to-human contact, that flattens the curve of the onset of the infection and takes the pressure off those resources and buys them time to treat people with resources that they need, buys them time to come up with vaccines and treatments, and buys them time to give individual attention with a sustainable plan so that they're not, making makeshift wards and stop doing all the other kind of medicine that needs to be done, like we've seen in Italy. In Italy, they stopped oncology. They stopped dermatology. They stopped all the specialty medicines, and everyone just became a medical team member. Doctors are doing nurse work. Nurses are doing janitorial work. Janitors are doing paperwork. Everyone's just in a frantic pitch-in to try to keep up with the incessant growth and demand of people coming in for interstitial viral pneumonia, because that's the name of the ball game, is
right.
Help these people survive this crazy pneumonia, and that every hospital bed is filled.
And they've got less staff available because the staff are getting sick.
The staff are getting sick.
Yeah.
So we can help them as teammates, as partners in this great fight against this virus, by doing our part, not just washing your hands, not just keeping your nose clean, but by not doing the things that we can put off until the fall, and being responsible in not transmitting this virus, and being mindful of the fact that everything we do to buy them time helps immensely in taking care of this challenge, because they need our help, and we need to be thinking about that. It's about so much more than, hey, I'm brave and I'm not going to let any virus push me around.
Right.
Or,
It's not about that. It's
No.
not about you as an individual right now. It's about us collectively as a society, and how do we work together to not take as big of a hit, it really is changing the mindset. And I get it. I understand why folks are being resistant to this messaging the way that they are. I mean, we've been trained, we've been programmed that way now to
Right.
be resistant to it.
But there's examples of this. In 1918, there was a parade scheduled in Philadelphia, and the Philadelphia city commissioner had the attitude of, I'm not going to let no virus tell us what to do. And he decided to have the parade anyway, and 200,000 people marched in this parade. And by the end of the month, everyone had the Spanish flu. And when all was said and done, 12,000 Philadelphians were in the morgue. Okay? Compare that to St. Louis, where the city commissioner there early on in the ballgame said, we're canceling all public events, we're closing down the stores, and we're coming up with plans to help everyone remain isolated, and make sure that we don't have events where people get exposed. By comparison, St. Louis only had 1,700 people die from the flu. So it shows a perfect example of what the smart choice does when your main tool in the fight is to be smart about getting together in large gatherings. And I think in this case, you have even more of an impetus for that because we have the lessons from history and we have the numbers right in front of our face as to what we're dealing with. They didn't have that kind of information back then.
Heck yeah, we've got information at our fingertips for sure. Now, it's still hard. Don't get me wrong. I mean, we had a lot of discussion about this with our board here as far as what are we doing. Because really, it's almost ironic for us at the Warrior Healing Center to want to promote self-isolation because the whole reason for the existence of the Warrior Healing Center is because we've got a lot of veterans out there who are isolated, and we want to change that. We want them to not be isolated. We want to bring them together and have them have a team and be part of a unit. So there was, like I said, a lot of diligence, a lot of thought and discussion, and a little bit of, I won't say arguing, a little debate, consternation about doing this. But all in all, I mean, we want to protect our community. We want to protect our veterans. We want to protect what's going to help our healthcare system and everything else. And I think that
it's all born of, we take our veterans' health very seriously. When isolation is bad for our veterans' health, we're opposed to it. And we want to get our veterans out and connect them with the resources they need to heal. When isolation is good for our veterans' health, then we want to make sure that that happens so that their health is taken care of. That's the bottom line, is we take health very seriously because, hey, the healing part of Warrior Healing Center is the operative word. That's the verb in what we do. And healing can't take place if we're running around infecting each other with some deadly, Indonesian junk that's going around, to quote the great philosopher Cheap Trick. We've got to be smart. And right now, when the governor has just declared a state of emergency, and I think in a few minutes here, the president is about to do the same thing.
That'll be interesting to see what he says. But today Arizona was the fourth state now to declare a state of emergency because of the coronavirus. And props to them for doing that because, again, we need to change as a community. We need to do things differently. We need to think about this differently. We need to understand what's happening and work together collaboratively to help change things, because keep doing things the way that we've been doing them and keep pushing back and saying, psh, it's just a virus. Guess what? That's going to take us all down.
Right.
So.
Yeah. Should we refresh it one more time?
Yeah. Man, I hope you've got like a good joke in mind or something to end on so that this is not like a total downer.
Yeah, we're up to 1307. A good joke. Let's see.
1307. What was it earlier?
1303.
Oh, okay.
Yeah.
4 more.
Well, I don't know what you guys think, but I think Ferg is a great addition to the live stream. I think we need to work on his endurance a little bit.
Well, in his
he's laying
defense,
down the job, but
he did another half live stream with us prior to this one.
There's no excuse. No excuse. There's no laying down on the job.
We need to work on that sound glitch.
Yeah. Just reboot before we go. It's easy.
Sure.
But hey, give us a call if you have any questions or concerns. Reminder that we've got Sam's Scam service that we've started. Oh, I guess it's Dan's Scam service. Dan the Scam Man is ready to serve you. So give a call and you can talk to Dan about any kind of scam that you picked up. If the IRS calls you and says that the cops are on the way, or if someone calls and says, hey, we accidentally deposited $3,000 into your bank account and my boss is going to fire me if you don't send me some gift cards. Any kind of fishy stuff like that, and you want to know more, give Dan a call at 520-221-4093, and he'll be glad to look it up for you and tell you what it's all about.
Awesome. He'll be doing that on podcast or live stream. What's our Dan the Scam?
Well, he'll take care of you personally, but then he'll also talk about kind of the lessons learned and the latest and greatest
Nice.
on his own podcast.
Okay,
that we're setting up.
podcast
So,
for that.
yeah.
Cool.
Mhm.
So stay tuned. Keep checking us out at the Warrior Healing Center on Facebook and YouTube. And I hope this has been helpful, full of some useful information. If not, let us
Stay
know.
off my
No,
lawn.
let us know. Stay off my lawn. We're definitely open to feedback. We'd love to hear it.
Yep. Thanks, guys. We'll see you next time.
All right. Adios. Good job.